Hello and welcome back to the channel. Today we're going to talk about, is the coronavirus vaccine safe for you? This is not a medical consultation, so please discuss this with your doctor and make sure you ask your specialist about your specific condition and it's going to be safe for you or not. But what we're going to use today is general Google question and see if we can get good resources for you to help you make your decision. So let's start. So if you do Google coronavirus vaccine information, one of the very important websites that come up is the COVID-19 coronavirus guidance from the government. And I'm going to zoom slightly on it so that you can have an idea which one is really important to talk about today. And looking at the contents, the one I want you to really concentrate on is who cannot take the vaccine. And if you scroll down to get more information about it, it talks about what potential side effects and everything. I'm not going to talk too much about it. Even patients who have cancer, leukemia, diabetes, dementia, heart problem, chest problem, kidney, liver. In the previous video was somebody who have irritable bowel syndrome or somebody else who had inflammatory bowel syndrome, like ulcerative colitis, asking, can I have the coronavirus vaccine? So this is really important. So according to the leaflet from the government, yes, you can, because it's safe to have that. Who should not have the vaccine? Clear here in the guidance that people who has severe allergic reaction to any of the components of the vaccine, which we were going to talk about it next part of this video, about allergies. It tells you who has got significant issues with allergy that should not take the vaccine. Women with the potential of having a baby, so maybe somebody who's already pregnant or thinking about having a baby, they should not be getting the vaccine. And even mothers who are breastfeeding should not have the vaccine, because the clinical trial did not really involve any of them in it, and there is a risk that we're not sure what's the long-term effect on the baby. And that's why even vaccines that has been licensed is not for children, so you have to be an adult to be able to get the COVID-19 vaccine. So that's really makes sense. So next we'll move to the allergy section. I'm going to talk about if you have an allergy. So one of the really useful websites is the anaphylaxis.org.uk website. It's really kind of easy to follow and has got really straightforward answer to your questions. So let's scroll through it. I'm allergic to penicillin. Can I take the COVID vaccine? And the answer is yes, you can, because none of the vaccine has got penicillin in them. 2, if you are allergic to latex, some patients have really severe allergy to latex, mainly skin allergies. Again, you can have this coronavirus vaccine. What about food allergy? Nuts, any other food allergies? Again, this is really important. The source of information, which is the Green Book. Again, it talks about it is safe to have the vaccine, because all of the vaccines that are available in UK, specifically mentioning Pfizer-BioNTech and Moderna, are safe to have with any food allergy. Even allergy to eggs. Some of the normal way of manufacturing vaccines, and I know some of the other vaccines not available in UK might be having replication of the virus in an egg, which makes it a potential allergy for anybody who's using it. So please check the content of the vaccine and speak to your doctor about it before you take it. So this is the end of the video. I'm hoping you found it useful. Please, if you've got any comment, leave a comment below if you want to have any questions. And also, if this was useful, please share it and consider subscribing and like the video. If you've got any question about what side effects happened to me after my first dose, please check the end of the video. And I'm gonna post another video about what happened after my second dose of the COVID vaccine. So please keep an eye out for it, and I hope you have a good time.